Welcome to Queen Victoria Hospital in beautiful Revelstoke, BC. I'm Caroline. I'm a maternity nurse here at Queen Victoria Hospital, and I'm going to take you on a tour of our facility. After that, you'll hear from Dr. Wild and midwife Ariel, who will take you on a tour of the labor room and the ways you can customize your stay. We hope to provide you with a view of what to expect when you have your baby with us. Let's get started. When you arrive at the hospital, you are free to park in the visitor parking on the right-hand side of the roundabout. There is no fee required. After parking, you can come to the front door. In daytime, we currently have a patient ambassador that will greet you upon your arrival. If you have any respiratory symptoms, we will ask that you come through the emergency entrance. If you are arriving before 7 a.m. and after 7:30 p.m., Monday to Friday, or 7:30 p.m. to 8 a.m. Saturdays and Sundays, please come in through the emergency entrance. Ring the doorbell to the left of the door, and a nurse will chat with you to bring you up to the labor room on the second floor. During regular hours, once you enter the building, you will be required to register at the front desk. You will need your care card here. From here, head up to the elevator to the second floor. Once you reach the second floor, the nursing station is to your right. A nurse here will gather information about your pregnancy and take you on into the labor room. Let's go have a tour of the labor room.
I'm Dr. Wild, one of the obstetric providers here at Queen Victoria Hospital.
And I'm Ariel. I work with the maternity team here as the midwife.
Welcome to one of our 2 labor rooms. The only difference between the rooms being the size of the room and the layout of the equipment. Both of the labor rooms have a private toilet for quick and easy access, as seen here.
Let's take a look at the birthing bed. There's a few different ways that this puppy can get set up, so let's run through them. The labor bed is unique in its ability to adjust and adapt to a variety of positions to help you while you're in labor. The bed is essentially 2 parts, the head and the foot of the bed, which can be individually adjusted and, if needed, can be separated. Attached to the birthing bed are footrests that can be useful when pushing. The bed also accommodates the use of a birthing bar, which can be used in a variety of different ways during the second stage of labor, to help hold up your feet, to squat with, or with the use of a draw sheet to help you when pushing. During the delivery, the bottom of the bed can be lowered and, if needed, completely removed.
We also provide birthing equipment, such as birthing balls and peanut balls. The birthing balls are great to be used in the first stage of labor to sit on and allow gravity to work with your baby. When sitting on the ball, you can lean on the bed and have your partner or support person rub your back or provide touch in a way that you find comforting. The peanut balls are helpful when laying in bed, where they can be placed between your legs, which may help to facilitate movement of the baby.
A few other items around the room that we'll introduce you to include the electronic fetal monitor. This machine may be used during your labor to monitor your baby's heart rate, as well as contraction pattern if necessary, on the basis of risk factors. With this monitor, we have the capability of monitoring you wirelessly, allowing you to maintain movement and comfort. However, the majority of births will be monitored in a similar way to that done at your prenatal appointments, with the use of a handheld Doppler done at frequent intervals to ensure that your baby is happy.
Over here, we have the baby warmer, which may be used after your baby is born if they require any help with their transition to the outside world. This machine is checked before each delivery, and all the staff who attend your birth are trained and certified with the skills needed to assist your baby. There is also a bath and shower that are available just outside the labor room for relaxing, laboring, and refreshing. Now let's take a look at the postpartum room.
Here we are. This is where you will be after your delivery. As you can see, we have a cozy bed, a pull-out bed for your partner or support person, and a bassinet. If you need anything from our nursing team while you are here, you can always ring the call bell attached to your bed to talk to a nurse. There's a few more things to know about our acute care ward. Down the hall from the labor and postpartum room, you will find a water and ice dispenser, a small patient fridge, and a microwave. There's no access to a kitchen or vending machine. We encourage you to bring your own cooler for storing personal drinks and snacks. Nursing can bring you other drinks as needed, such as coffee, tea, and ice water.
You are welcome to bring items to make this space your own, including both the labor and postpartum rooms. A speaker perhaps to play music, battery-powered lights, no open flames, a diffuser with scents that you find calming and relaxing, your own pillows perhaps, including a breastfeeding pillow, or blankets, food, and drinks. We can also dim the lighting in the room to make it softer. We also recommend that you do bring comfortable shoes for support while you're laboring. On behalf of the maternity staff at Queen Victoria Hospital, we look forward to seeing you soon.